Today I'll be talking about chapter 6 in your book, which is all about diagnostic agents. We will talk about some terms and abbreviations, and then we'll talk about each of these things, radiographic contrast media, dyes, and staining agents, and how all of these are used in surgery, and give you guys some examples. So a lot of these things we're going to talk about are actually unique to surgery. You're not necessarily going to find them used anywhere else in the hospital. Also, you're not going to necessarily find these in the physician's desk reference. So why we use these in surgery is because surgery depends a lot upon visualization of tissues. So these agents we're going to talk about help to give some insights into positions of things in the body, activity of structures, and overall health of all of these structures. The first thing I want to talk about is contrast media. This is now known as radio-opaque contrast media, or ROCM. You'll hear me refer to this a lot as contrast. These are agents that are used in certain diagnostic radiographic tests. So we're talking about X-rays here when we're talking about radiographic tests. Radio-opaque chemicals, this means that they don't allow X-rays to pass through. So on an X-ray, these structures will appear opaque or solid. Such things as tumors, maybe stones when we're talking about kidney stones, and blockages will all become visible with the help of these contrast dyes. Also, keep in mind in surgery, a lot of times we're going to refer to these agents as X-ray dye, but you don't want to confuse these with dyes that are used to stain the tissue. They're two different things. Another thing that it's important for you guys to keep in mind is a lot of contrast media does contain iodine. So if a patient has iodine allergies or shellfish allergies, we have to be really careful when using the contrast media in these patients. There's some things that we need to do. And keep in mind, radio opaque doesn't allow X-rays to pass through. That is the opposite of radio transparent, or allowing X-rays to pass through. Dyes are going to be solutions that color or mark the tissue for identification. We use these for a lot of different things in surgery, anything from staining the skin to coloring urine. And then staining agents, these are chemicals in a solution that react differently with abnormal cells than with normal cells. They're going to basically help us to identify abnormal tissues for biopsies or excision of these abnormal cells. So the first thing we're going to talk about in a little more detail is contrast media. Examples of these are going to be Omnipeg, HiPeg, Visipeg, and IsoView. You may hear all of these used in surgery. You can also see this chart here, which will give you the trade names of each as well as the generic name. You'll be familiar with these, especially as you do your drug cards. You'll see some of these pop up. Contrast media is going to be classified into two main categories. One is ionic, which means the molecules break apart into ions when they're dissolved in water, and non-ionic. These don't break apart when dissolved in water. Non-ionic ones are going to be the Visipeg, UltraVist, IsoView, Omnipeg, and Optiray. And then just two things to keep in mind. All of the contrast media we use in surgery is going to contain iodine. There are some non-iodine options out there. Those aren't typically used in surgery though. These are going to be barium sulfate, which can be used in X-ray and CT scans, gadolinium, which is used in MRI, and then saline and gas are used in ultrasound, CT, and MRI. So those are the only things that don't use iodine, so keep that in mind. So in general, contrast media is used a lot in radiology and the operating room. So we're talking about radiology using X-rays to take pictures. The contrast media, when used with the X-ray, provides contrast so you can see different structures. It can be instilled into cavities or tubular structures, and it basically just improves the visibility of that internal structure. So keep in mind, as a surg tech, you're going to have to be careful when preparing these agents because just like anything else you handle mostly on your back table, they're going to be clear in color. so it's going to be really easy to confuse them with other medications on your back table. All of this contrast, these can be used in vascular structures, urinary bladder, kidneys, the GI tract, and the biliary tree. One of the specific examples we're going to talk about is HiPEG. This is supplied in glass vials of 50 ml. It's an ionic agent. It is also categorized as a high osmolar contrast medium. So what that means is there are more adverse effects associated with intravascular administration of these agents, and it is used a lot for retrograde urography. Definitely don't want to use this for intrathecal administration, and you don't want to inject it directly into the carotid artery. The picture here that you can see is a post-operative cystogram. So this just shows a nice round picture of the bladder. You can see there's no leaks, so they might have been worried about a perforation in the bladder. If there was a perforation, you would see this contrast dye leaking out from somewhere. So this is what they're talking about with the retrograde urography. Retrograde just means you're instilling that contrast solution and it's going upwards, and you can use it for different structures of the urinary system. Omnipeg, this is another contrast medium. It's water soluble and iodine based. It does come in a lot of different strengths. This is one of the few contrast mediums approved by the Food and Drug Administration for intrathecal use, but only in certain concentrations. We'll talk about intrathecals later in one of our last chapters. And then retrograde urography, it can be used for this. So it's going to help to visualize renal structures and detect possible blockages such as kidney stones. You can see on the picture here, you see the spine in the middle and then the pelvis, the bone, and then you can see where the arrow is. That is pointing to a blockage in the ureter, which is probably a stone. Way high up, that is where you can see the renal pelvis and everything associated with the kidney, and that lower portion is where the stone is. So this is just helping them to detect where that blockage is, so then they can go in and put a stent or something in, or grab the stone and take it out. When I mentioned the intrathecal too, that's just where this dye is going to be injected into the lumbar subarachnoid space to help visualize spinal cord and nerve roots, so it would be appropriate in certain concentrations for that. And then this also can be used in blood vessels. It will opacify those blood vessels when injected. It can be used in angiographies, which will show blockages or abnormalities of the vascular system. After they've removed maybe a blockage from a femoral artery, they can confirm that it's been completely cleared out. And then also, if they put in an aortic stent graft, they can confirm the graft position using this as well. So it does have some other uses besides just in the urinary system. This is contraindicated for people that have a known hypersensitivity to iodine without proper pre-medication protocols. Typically, they'll just give them Benadryl, and that's going to help to offset that allergy. IceView is the next one we're going to talk about. This can be used for intravascular and body cavity administration for radiographic procedures. It needs to be used immediately after opening because it will start to lose its strength after it sits out for long. You want to keep this away from the light as well. It comes in various concentrations, and this can be used for cerebral angiography, CT enhancement, and contrast enhanced head and body imaging. So IceView M is the only formulation of this IceView that can be used for intrathecal administration, only in concentrations of 200 and 300 milligrams per milliliter. Don't have to worry about that. Just know that it should only be used in special concentrations intrathecally. Visipeg is another contrast media. It can be used for cardiography, peripheral, visceral, and cerebral angiography, contrast enhanced CTs of the head and body, excretory urographies, which means that they want to see how the bladder is emptying, and as well as peripheral venographies. It won't be approved for intrathecal use, and this can be supplied in bottles that can range anywhere from size of 50 ml all the way up to 200 ml. So you can find some different sizes depending on how much you're going to need for the procedure. Now we're going to move on to dyes. Examples that we're going to talk about, methylene blue, isosulfan blue, indigo carmine, and gentian violet. All of these are going to be solutions that color or mark tissues or enhance just the direct observation of a structure. If you look in your book, there should be a table in there, I believe it's 6.2, that'll talk about dyes used in surgery, and we'll specifically talk about each of these here. First, we're going to talk about methylene blue. So this is going to be helpful in surgery in a couple different ways. The first two things we were talking about here with bladder injury and tubal patency, we're using this in conjunction with a laparoscope. So this just means that, like the picture here, we're inside the abdominal cavity. You also could do it through a big open incision, but typically you're just going to be looking through a little camera, and you're going to be looking in the body. So the first one, you're going to be looking down at the bladder. What'll happen is the methylene blue solution will be put in through the Foley to the bladder, where any of this would leak out if there's a tear in the bladder, and you'll see this as it flows out of the damaged area. So if you're worried about the bladder having been punctured at some point, this is going to be a good way to detect that, because if you see any blue, you'll know that the bladder's had an injury to that area where it's coming out. It can also be used to assess tubal patency. So you can instill this, and as you watch it flow through the fallopian tubes, it'll exit into the pelvic cavity. So if it doesn't exit out, then you know there's going to be a blockage in the fallopian tubes. Maybe somebody's had a difficult time getting pregnant, and this could help explain any issues they've had. Maybe there's something wrong with that tube. And then a separate thing is methylene blue can also be used to mark skin incisions. This has been replaced now basically by marking pens a lot, but in the past they would use this to actually mark skin incisions, and it would be that bright bluish purple color. Be careful when handling this. These are very permanent dyes, and if you look at the bottle here, you can see it's a very blue color. So if this gets dropped on the floor in the operating room, you better believe it's going to stain it for a very long time. So just be careful in handling it, okay? These are available in a 1% solution. You may see them anywhere from 1 ml, 10 ml vials, or even little 5 ml ampules. In the picture that you see here on the bottom right, again, this is just assessing tubal patency. What you see in the middle, that's going to be the uterus, and then off on each side, the tubes and the white structures are going to be the ovaries. Isosulfan blue, or lymphozurin 1%. This just helps to delineate lymphatic vessels. It'll be used in a sentinel node biopsy. It's a sterile aqueous solution. So what happens with this is in radiology or nuclear medicine, radioactive isotopes are going to be injected into the area. This will enter the lymphatic system, and it's going to settle into the first or sentinel node. So this is just going to be helpful. It's injected before the prep. That lymphatic system carries the drug, and then the surgeon will be able to follow that blue drainage path to the first node, like I mentioned, the sentinel node, and they'll send this to pathology. Also, you can use with this a gamma probe to help you find radioactive hotspots, and it makes like a loud noise when you put it over the skin if you're in an area that has a lot of that isotope solution. So it's just a way to get to that first node to send off to see if cancer has spread. And then there's indigo carmine. This is given by IV, so typically the anesthesiologist is going to be the one giving this to the patient. It can take up to 10 minutes to show up, so you have to be a little bit patient when you're waiting to see this. It can be used to color urine for verification of kidney function. So if you're worried that kidneys aren't working, if they use this and it shows up blue, then you know the kidney's doing what they're supposed to get rid of things. It also can help you to identify leaks or damages to the bladder and ureters. In cystoscopy, or when you're going in to view the bladder, it can help to verify the ureteral orifices. So the picture here, you can see there's not really anything. You'll see like a little opening, but then that blue where it's draining out, that's the opening to the ureter. So sometimes doctors may have a really hard time seeing those openings if they're trying to put a stent into the kidney. So if they can't find it, maybe there's a bunch of polyps in there or their anatomy is just a little bit different. This indigo carmine is going to help them to find that opening. And then gentian violet. This has now been used to help mark skin incisions. Also can be used to label containers of medications. You can see right here that somebody scrubbed in as the surge tech, and they have sterile labels and a marking pen, so they're using this to write out their medication labels so they can label things. Also keep in mind that gentian violet is an antifungal, so it's going to work well topically in the oral cavity for thrush, can be used vaginally for yeast infections, and in the ear canal for fungal infections. Now on lastly to staining solutions. These are chemicals used in a solution that help you to visually differentiate normal from abnormal tissue. There's one specialty that you're mostly going to see this in, and that's going to be gynecology. So we will talk about Lugol solution and acetic acid. Lugol solution, this is used for Schiller's test for cervical dysplasia. So essentially, this is just a strong iodine mixture. It's going to be applied to the external cervical os. Abnormal cells aren't going to take up the brown stain as easily and readily as the normal cells, so it's just going to show you the areas that need to be biopsied. So we'll look at that on the next slide where you can see a picture of it. It also can be used for overactive thyroid gland function and iodine deficiencies, and it can protect the thyroid gland from effects of radiation. You don't want to use this on anybody that has a history of iodine sensitivity, and also don't confuse this with Moncel solution. It's a chemical hemostatic agent as well, and it does kind of have that same brownish color, but it's going to stop bleeding after you perform a biopsy. If the cervix keeps bleeding, you can apply Moncel solution, so that'll stop bleeding, whereas this is just helping to see structures better. So you can see this is a picture of a cervix that has had the Lugol solution painted on there. So before, on the left, that C picture, that's just the normal cervix without the application of Lugol solution. That AWE portion, that's the epithelium that's abnormal. And then if you look over on the next page where all that was, you can see that it looks different. So it just helps you to see that abnormal area that needs biopsied. Acetic acid, you probably know this more commonly as vinegar. And this can be used for cervical dysplasia for laser excision. So this will cause abnormal tissue to appear whiter than the surrounding tissue, which you can see in B, how it shows up more white. You don't want to use this with the Lugol solution because if you did, that tissue that was stained brown can interact with the effectivity of the laser. So that's why they prefer to use acetic acid anytime the laser is going to be used. So again, this is just helping you to visualize structures better. So if you guys have any questions, please feel free to jot them down and we will talk about them later when we get together. Have a good day.